So for the pin and stretch technique that I'm about to be doing here, Maddie, you're going to shorten the muscle and then lengthen it, okay? Yeah, exactly.
Just having a lot of upper back tension.
To examine a hip flexor dysfunction, there's a couple ways to do it. Someone who has a dysfunctional hip flexor, they're going to have pain when you start closing down. But she has an excellent range of motion, so probably no pain there, right?
No.
You sure?
Yep.
Okay. They're likely going to have awesome external rotation because that's opening up this relationship between the femoral head and the acetabulum. But when you go into internal rotation, so you have out of this world internal rotation.
Still gets it though.
You felt a little pinch in there?
Mm-hmm.
Okay. So most people, frankly, if you push hard enough, you're going to feel a pinch in your groin if you internally rotate your hip enough. But I would say that yours is well within, maybe exceeds normal limits.
Sick.
Pain there?
Mm-mm.
Pain there?
Mm. Crazy.
Good there?
Yeah.
Okay. Someone with hip flexor dysfunction might also get a little bit of pain with this figure 4 move. You're a little tighter in that. This is not as sensitive though because this kind of motion can be inhibited by some of the more posterior musculature too. Do you feel any pulling in the front of your groin there?
A little bit here, but not like crazy.
Okay. And then just something else you can do. In a perfect world, we do not have the ideal table to be doing this on right now. In a perfect world, we'd be on like a massage table where I could get her to scoot her legs to the crease of the end. Yeah. And sometimes when people's hip flexors are really tight, so something else I need to say. Another prime hip flexor is actually, it's your rec fem. It's one of your quads where it anchors up, it crosses the hip joint. So although it's not that iliopsoas muscle that dives through your pelvis, your rec fem can sometimes act as, it does act as a hip flexor. So if you kick a leg off to the side like this and you notice that someone's leg is a little too extended, you might be able to implicate the rec fem in that too. Okay, so here's how I'm gonna treat this today based on the fact that she has just kind of, honestly, relatively benign run-of-the-mill hip flexor pain. I'm not gonna dry needle her. I'm not gonna use shockwave. That's for something more like a psoas tendinopathy. But what I am going to do is some very uncomfortable soft tissue work where the belly of the muscle, belly of the psoas is in her abdomen. And then I'm gonna kind of work down into her groin too. So for that, I'm gonna need to get some help. Be right back for that. So the way we're gonna start a psoas release is we're gonna get Kaylee. Have you ever had this done before?
No. It's gonna be so fun and exciting.
This is gonna be a really, this is gonna be novel to say the least. So we start with a nice flexed hip, and then I'm gonna essentially come in, I'm gonna slide the viscera out of the way, I'm gonna weasel my way between the obliques and the rectus abdominis. I know it's not comfy, but I'm gonna run, yeah, she's kind of feeling me get there. There.
Oh my God.
That hard band that I found, that is your psoas. It's all the way up there. So Dr. Jonathan is slowly going to extend the hip while maintaining downward pressure. It's really intense. He's going to push down, so he's going to adduct the hip. Amazing. And you're going to reach over your head with your right arm as far as you can. So that's really going to just elongate. Wow. Yep. So there's one rep. You okay there?
Yeah.
You sure?
I just need to breathe.
You do.
Yep.
Okay. So now I kind of know what I'm doing. I'm gonna weasel my way down into a more lower part of that belly. She's gonna feel it in 1 sec. Go for it. There. Reach that arm overhead for me.
I forgot.
Yeah. I know you don't appreciate that all that much. It's a little wild.
That one's freaking crazy.
It's crazy. So for this next one, I'm gonna like grab her ASIS, curl in, and try to pick up a little more of that iliacus, which is a different flavor. Go for it. Give me that big reach. I know that's super special. Amazing. And just for the very last pass of this, I'm gonna come right onto the tendon itself.
That feels funky.
I know it feels funky. Go for it.
How fun.
And then reach. Frankly, this is probably the least intense one of all.
100%.
Amazing.
Wicked.
You okay after all that?
Yeah.
Thank you for your aid, Dr. Jonathan. I appreciate you. Just for the sake of today, let's pretend that she has a right-sided torticollis or is experiencing pain on the right side of her neck. So I would just come through here, and it's important to remember that the levator scapulae, although it is an upward rotator of the scapula, and one of its attachments is down here. The levator scapula anchors on the transverse processes of the top 4 cervical vertebrae, so it ends up being important to do a lot of work up top. Is that tender up there for real?
Yeah,
is this the side you actually have pain on?
Both sides.
Both
But
sides.
like it's very tender. Ooh.
So I might be taking a little bit of a liberty with Sabrina's neck. Someone with a torticollis might not let me move it quite this much. You okay with that?
Yeah.
You say it's this side as well? Mm-hmm. Bilateral? My lord. Okay.
Well, how often it happens, it just
I feel like it happens once
on
every
both
6
sides.
weeks.
monthly.
Monthly.
Maybe.
So it's hard to say. It's hard to say what exactly causes a torticollis because you're sleeping while it happens, but it's common if you have a window open or if you have a particular side of the room that the fan is on. So essentially, like the direction of draft. In your sleep, you turn away from that and end up irritating the facets on the side you turn into. So that's maybe something to keep in mind if you keep getting a torticollis on the same side of your neck. So this is me working on her traps a little bit. You okay?
My traps are tight.
Good Lord. They are tight.
You feel it jumping?
Wow, yeah, right there. Oh, my Lord.
It's all good. It's all good.
Yeah, it's all good. All's well that ends well. And you said you got one, was it Saturday?
Yeah.
Maybe a little one? A baby one?
What was it? Saturday? No, Friday. I guess
You woke up Friday morning a little irritated.
a little bit, and then it was worse Saturday morning. More so, like in the middle of the night. I'll just wake up because I'm uncomfortable.
Got you. So it's gonna maybe lack a little bit of relevance because she's not in acute spasm, but a way that I could get through a neck that is spasming harshly is I would say, Sabrina, could you push your head into this hand? 5, 4, 3, 2, 1. You could stretch it a little farther. And this is that stretch, relax, that contract, relax kind of stretching. And then from this new position, I would say press into my hand again. 5, 4, 3, 2, 1. Relax. And I could kind of strip against that as I stretched it farther. You okay with that?
Yeah.
Okay.
First, I just want to look at how she's globally standing, if there's any antalgic leaning away from midline or anything, but she looks very good. And try to touch her toes without bending your knees. So she gets there really easily. And come back up for me. Any pain going down or back up?
I feel it both coming down and back up.
Okay. In the same spot too. I want you now to bend towards your left as far as you can. Keep those shoulders stacked. Let that hand just naturally fall. Good. Go this way. Okay, so function is still really there. And then you're going to bend backwards for me from your low back. And I'm going to help support you. Good. Bend towards this side now. Any increased symptoms on that side?
Oh yeah.
More so when I pinch.
left.
Yep. And then one more time straight back. And then rotate this way. And then how is this side?
That side's fine.
That side's fine. Okay. So that was a positive chems test. So generally where some of the facets in your low back can be jammed together, which could be one of the things we're dealing with. I want to get you on the table, please, face up. And I'm going to check some of the surrounding tissues that connects to the spine. So bring this knee up, and then you're going to hold that with your hands. And I'm checking to see how much space she has in the other leg, and then switch. This is left. So hip flexors are a little tighter on your left, and if you want to actually come around, and we can do that again. So pull this leg in, and then if we can kind of see, I can probably put 2 hands width underneath. So that tells me that she's a little tight in her hip flexor. And if you do the opposite side, and see, this one's a little bit more flush against that. So I'm thinking already that sometimes the hip flexor muscle, your psoas, specifically more the iliacus, if that's tight, that's gonna pull that pelvis forward and then pull on the SI joint. So it kind of, what you're saying points right to that point there. And it could be SI related. We're gonna kind of roll that out now. But a lot of times it could be more of a dysfunction or tightness in a muscle causing some pulling reactions to cause what mimics like a SI joint. So you're gonna bring this up, you're gonna cross this over this leg, and then I'm gonna place one hand here, and then I'm going to distract. And any pain with that? Good. Switch. And also kind of joint playing too at the end. How was that one?
Good.
That one's good? Cool. Bend this knee for me again. So a lot of these tests now are gonna be checking her SI. And good spring with that. Any pain? Beautiful. So I'm kind of rolling, finding the SI joint, closing in on it, and then I'm springing the joint. And how is that?
Good.
Good? Mm-hmm. Good. Face this way on your side. Just gonna do a compressive test now. Any symptoms related to this?
No.
Good. Flip on your stomach. And I'm gonna place my hands here, palpate your actual SI joint. And the SI joint should move very, very minimally still. And there's good springs. Any pain with that?
Nope.
Beautiful. So, quad stiffness as well. Do you feel like a stretch in that front?
Mm-hmm.
Also, there too. Did that reproduce any of that tightness back here?
No, it didn't.
Okay. So now we're static joint playing. Have your hands fall to that floor. So static palpation wise, she moves pretty well. She's a little fixated in her L5S1. And her CT junction. So if you want to sit up for me, please.
Okay.
And face away from me, sitting on your butt. Give yourself a hug. I'm going to motion palpate now. So I'm going to have my hand across and spring SI joint. So what I'm feeling for is just hitting almost like a brick wall, block of cheese, however you want to describe it, and then almost joint playing. So she has pretty good motion, and her upper moves really nice. You see this nice undulation. and then she's a little stuck through here, and then down here. So I'm gonna say a lot of your symptoms are musculature in nature, just pulling a lot on these joints here. So adjustments will definitely help kind of loosen the joint up, as well as the tissues attached to that area.
So like I said, that piriformis muscle runs from the sacrum to the hip here. So I'm going to be using my elbow as compression to that piriformis, and then I'm going to use Christian's leg here and passively go throughout the motion. So as I'm adding pressure right through here, I'm passively taking his leg and hip into internal rotation. Good. And do you feel that right through there, Christian?
Absolutely.
Okay, good. Let me know if it ever goes above a 7 out of 10 on the intensity scale.
Got you.
So as I'm going, I'm kind of palpating with my elbow here and doing a light scan to see where he's holding most of that tension. And for Christian, it's up a little bit higher. So I'm going to get a good angle here, do 2 more passes. Good. 1 more. Good. Okay. And not only is pin and stretch a good modality or technique that we use here at the office, for piriformis syndrome, if you have that entrapment at the piriformis for that sciatic nerve, we would use dry needling. That basically would go through all the glute musculature and into the actual piriformis itself to relieve that tension there.
Kaylee, how has 75 hard been treating you? What's been the most challenging aspect of it?
The second workout.
The second workout.
First one's fine. Jeez. I can get up, but like I don't want to. But finding time for the second one sucks.
Good. So Kaylee right now, she's holding a lot of tension kind of around her TL junction. That's where her mid-back meets her low back. She's also real defensive about any sort of pressure over this left hip area. She doesn't like that pressure, so she tightens up. All right, we're gonna work through here first. Breath in. Let it all the way out. Good. Good. Do another breath. All the way out. Better.
That was better.
You actually breathed on that one.
Oh, weird.
So for the pin and stretch technique that I'm about to be doing here, Maddie, you're going to shorten the muscle and then lengthen it, okay? Yeah, exactly. Okay. So
It's like tickle hurt.
yeah, it's just going to feel like that. Let me know if it ever gets too intense though, okay? So all the way up here is in the shortened position. I'm going to place my thumb here, and then you're going to lengthen it. Yep, Ooh. Good. And just keep doing that yourself actively, okay?
Slower?
Yeah, just slow it down a little bit more there for me, please. Oh. Yep. Good. Can you give me 3 good ones here? So again, I'm working that tendon all the way up to where it attaches to the muscle belly itself here. So there. Yep, you're good. And 1 more here for me, Maddie.
Sorry, I went down
you're
too
okay.
quick.
All right, then go ahead and go face down here for me, please. Another thing that we see, if it's been a chronic issue, not the case for Maddie here, if you have a lot of that irritation to this muscle, you'll tend to find that the other side will become infected because of overcompensation there. So I would be checking the left ankle, left knee, and left hip if this was a prolonged injury. But Maddie, you were good. You're getting it treated right away, so we love that there.
Yay! Ow!
Yep. So Maddie, you're going to feel a lot of pressure right through here.
What are you doing? Okay.
Doing the knee adjustment right through here.
Oh!
So a lot of pressure.
Okay.
And it's just going to be a little bit of snap. Good. And then 1 more right through here. Good.
So a lot of computer work, a lot of writing, a lot of drawing, I'm sure. Most of this, your drawings are probably digital in nature, right? Yeah. Which means a lot of mouse work with this hand. So I haven't seen her it's been about 2 months since I've seen her, 3 months. I think you saw my father when he came in last time.
Oh, that's possible.
According to his pencil on that. And so I'm going to do some soft tissue work with her on her forearm. She's got more of like a retinaculum irritation, kind of overuse to the tissue here. You're going to get to see shockwave therapy for Brittany on the forearm. Shockwave is really good for breaking up scar tissue. We're also going to be dry needling, heat and stim. We're doing a lot of things to this general area to loosen it up as well as to change her presentation of pain. Sometimes I tell her that, you know, bracing and supporting this can be very helpful, especially at night. If it's really aggravated, there's some things that you can do to help with, especially like the nighttime pain. You can sometimes get used to have pain over here as well.
Yeah.
Not as much anymore.
No, it's mostly the rib, and it travels.
Okay, rest. And you're like, oh yeah, can you work on my hip, my neck, my lat? No, I'm just kidding. Everything. And I'm happy to. I really am. With the focus on this though, because this is definitely what takes the cake for her, and I've seen it before. Never had shockwave on it though. That'll be a good thing for you to get periodically coming in with your work. Do you brace it up at work at all or no?
Not at work because I can't move. Like it's hard to.
It's really stiff.
Yeah, it's just hard to do the mouse manipulation that I used to do
With it on. It'd probably cause more problems than not because it's just so tight around that area.
I should wear it more at night though.
Fair enough. Especially when it's symptomatic.
Yeah. Good point.
That's what I went to school for right there. Just, I got you. So we got the holidays coming up.
Yeah. You ready?
Yeah. Thankfully, I am ready because I have an amazing wife at home that just takes care of everything for me. Yes, I'm just here to do this right here. This is what I'm good at. No, I have to do a couple gifts tomorrow morning.
You have to do the adult assembly required
Yes.
portion of the gift.
Exactly. We were pretty simple. I really wanted to get, my daughter said to Santa, I want a mountain bike so I can mountain bike with Daddy. I was like, oh my God, I'm crying. And then I'm like in the shop yesterday and I'm like, okay, like, take my money. What's the nicest mountain bike? I was like, she's 2.5 and she can barely get on the bike right now as it is. Do not get that bike there. So we got the little Strider, like, balance bike for her. So she'll start to learn how to do that. I'm excited.
That's fun.
You see me adjust her wrist, her elbow, shoulder, first rib, all the way up the chain, because all that stuff gets tight on her. I'm barely holding on her fingers on that one. Yeah, I'm excited. So we got her little Strider, we got the kids' little tablets.
Ooh.
Oh yeah, that's like peace. That is what that is right there, baby.
A gift for you or for that?
It's definitely a both gift. What'd you get your fiance? This video will come out after Christmas, don't worry.
Some clothes.
Nice.
A coffee warmer so that he often, to always have a hot cup.
That's sweet.
Yeah, he saw it online when we were doing our wedding registry and I was like, I don't need that. And I was like, oh, I could get it then for Christmas.
Nice. There you go. A little clothes action.
Yeah.
You know, some stuff. Is he an engineer as well, too?
Yeah.
You guys are so smart. Straighten this out. Come back. Straighten. I'm feeling an adjustment here, okay? I'm gonna do this, and this. It's really quick. Let it go.
Ooh.
Yeah, it's good motion to the joint. And then you're gonna feel a little pressure. There it goes.